Tinnitus is a condition characterized by hearing sounds when there are no external sounds. These sounds can range from ringing and buzzing to hissing and growling and can be intermittent or continuous. Although the exact cause of tinnitus is not always clear, there are a number of factors and conditions associated with its occurrence. 1. Hearing loss. One of the most common causes of tinnitus is damage to the tiny endings of the auditory nerve in the inner ear. This damage may be caused by age-related hearing loss, exposure to loud noises, or other factors that affect hearing. 2. Exposure to loud noises. Prolonged exposure to loud noises, such as loud music, heavy machinery, firearms, or explosions, can damage the sensory hair cells in the cochlea, causing tinnitus. 3. Earwax blockage. Earwax buildup can cause irritation or pressure on the eardrum, causing tinnitus. 4. Diseases. Certain diseases can cause tinnitus, such as Meniere's disease, an inner ear disorder that affects balance and hearing, temporomandibular joint (TMJ) disorders, high blood pressure, cardiovascular disease, or tumors. 5. Medications. Some medications can cause or worsen tinnitus as a side effect. These include certain antibiotics, cancer drugs, diuretics, and high-dose aspirin. 6. Head or neck injury. Trauma to the head or neck can affect the auditory system and cause tinnitus. 7. Stress and anxiety. Stress itself may not directly cause tinnitus, but it can worsen symptoms or make them seem more bothersome. Most asked questions. Can tinnitus be a sign of a serious health condition? Tinnitus itself is not a disease but a symptom of an underlying problem. It can be associated with a variety of health conditions, but is not always a sign of a serious problem. However, it is important to consult a medical professional to rule out underlying health problems. Can stress cause tinnitus? Stress itself doesn't directly cause tinnitus, but it can worsen symptoms or make them seem more bothersome. Stress can cause other health problems that can indirectly affect tinnitus. Can tinnitus be treated? In many cases, there is no specific treatment for tinnitus. This is especially true if tinnitus is associated with age-related hearing loss or damage to the auditory system. However, a variety of management strategies and treatments can help individuals effectively manage and cope with tinnitus. Does exposure to loud music always cause tinnitus? Prolonged exposure to loud noises, including loud music, can damage the small sensory cells in the inner ear, causing tinnitus. However, not everyone who listens to loud music causes tinnitus. Is tinnitus a common side effect of medications? Yes, certain medications, such as some antibiotics, high-dose aspirin, diuretics, and certain cancer medications, can cause or worsen tinnitus as a side effect. If you suspect that your medication is causing your tinnitus, talk to your healthcare provider before making any changes. Can tinnitus in one ear be different from tinnitus in both ears? Tinnitus may occur in one ear, unilateral, or in both ears, bilateral. The cause and management may vary depending on whether it is unilateral or bilateral. Does earwax buildup always cause tinnitus? Earwax buildup can cause irritation or pressure on the eardrum, causing tinnitus in some cases. However, not everyone with earwax buildup experiences tinnitus. Understanding the root cause of tinnitus is important for effective management. Treatment may include addressing the underlying condition, if identifiable, managing stress, using hearing aids for associated hearing loss, and using techniques such as sound therapy to help mask the noise of tinnitus. If you are experiencing tinnitus, it is important to consult a medical professional or audiologist for appropriate evaluation and guidance.